Hello, it's a pleasure to be here and talk about this important area of measuring different contexts in which children grow up and develop.
Is your mic on?
Oh, where is it? It's on? And I was assigned the task of basically talking about everything else that everyone else didn't talk about. So nothing, so things that Taryn didn't talk about, things that Abby didn't talk about, and things that Claudia won't talk about. So it's going to be a bit of a wide-ranging conversation about the context, why it's important to measure context, what is being measured currently, what's in development, and what could be measured in the future. So we're interested in measuring the context in which children develop because we know development results from interactions between children and their environments. By environments, we refer to not only the family and the community, but also more distal levels of the environment represented at the state, national, and global levels. While the more proximal and immediate influences on children will take place in the family and community, these distal levels are important because they create the policies and decide on making the investments to implement the policies that can benefit young children. So basically, the more we strengthen these various levels of the environment, the more likely we are to increase the chances of children developing their full potential. Across these different levels of the environment, most countries invest in various programs and services to improve children's development, such as health and nutrition services, and education and care services, and social and child protection. So it's important to have a set of indicators that can measure the context in different levels and in different domains, so different nations can understand whether their investments in different sectors and different programs and services are making an impact. Data on contextual variables can be collected in the existing surveys via parents, clinicians, teachers, or government representatives. No matter what indicators are used to measure the context, it's imperative that they're well-defined, evidence-based, reliable, and valid. They should also be universally meaningful, easy to measure and interpret, capable of showing change, and presented in a format that's easily understood by the people who can make a difference in improving children's lives. We also know it's important to measure context because there's good evidence that children who are exposed to multiple risk factors are likely to show developmental decline. This is a graph from a small study that was conducted in New York many years ago. And on the y-axis, you see IQ score, and on the x-axis, you see a multiple risk score, which represents the number of risks children are exposed to. And what you can see is children who are exposed to, say, one risk don't show much of a decline. But as children are exposed to more than one risk, you're more likely to see a decline in their scores. So this highlights the importance of measuring multiple aspects of the environment rather than just focusing on a few. So which indicators are out there presently? You've heard quite a bit already. And there was a review recently conducted commissioned by UNESCO, which focused on reviewing indicators in these 5 key areas. And the results are a bit staggering. There are hundreds upon hundreds of indicators and different indices to use them. There's some agreement on what to use and what to measure, but not consistently so. This is an example of some of the commonly used and less commonly used indicators used by USAID, UNICEF, UNESCO, and WHO. And the black X's indicate where measurement of these indicators are done pretty consistently, and that is they're part of the core surveys. And the gray X's represent where measurement might be done optionally by countries, but is not done consistently all the time. And obviously, the blanks indicate where no measurement occurs. So you can see there's consistency in measuring health and nutrition factors across all 4 organizations. And 3 of the 4 measure poverty or wealth and some aspects of child protection, but there's less consistency in measuring the other aspects of early child contexts, such as education, early education attendance, early care received by young children outside of an ECD program. Very little measurement on the cognitive, social, emotional, and language development of children. And likewise, very little known about the household support or stimulation for learning. So this graph is my attempt to illustrate how different categories of indicators are prioritized by age. So this might seem a little confusing, so bear with me, and I hope I can explain it well. You see the solid bars here at the top indicate or represent indicators that are measured across the age span from birth to 8 years old. So there's some measures about poverty alleviation and social protection that are linked with young children across that age range. Where you see gradients, this indicates measurement that is not prioritized across the entire age span. And where you see the darker colors, the darker parts of the bars, that indicates where the ages where measurement is prioritized. And where you see the gradients kind of fade out, that indicates where there's less priority in measurement. So for example, when we look at health and nutrition and the caregiving practices that support health and nutrition, this represents greater emphasis on measurement earlier in life with less emphasis on measurement as kids start to enter primary school. On the other hand, we see a reverse pattern when we look at education and care services and development of children. Very little, if any, measurement occurs early in life, and more occurs as children get closer to primary school. So can measurement be improved? Well, one recommendation would be to have a more comprehensive measurement of children across the age span. More comprehensive in terms of measuring at the same thing at each age, or the same construct rather, across the entire age range, and making sure there's more consistency in the measurement from year to year. One area that we have noted in our work with various efforts to improve measurement of ECD is there's very little known on responsive parenting. Responsive parenting refers to the capacity of parents to respond in an age-appropriate way to their child's needs. And so one area of improvement in understanding the caregiving context would be to have some kind of measure of responsivity that can include responsive feeding, and at older ages, some kind of support for children as they enter primary school. Similarly, as has been highlighted earlier today, there's very little understanding about the quality of care children receive from multiple caregivers. Many children grow up in areas and homes where they don't have just one primary caregiver, and they may be cared for by lots of different relatives, maybe neighbors, maybe children, etc. But we really don't have a sense of how to even measure that. But I think it could be an area that's important to understand. Likewise, we don't have good ways of measuring home-based care. So children who are being looked after in a custodial way, it has not really been evaluated in terms of quality. Other ways we can improve measurement would be to have a more developed way of screening for specific disabilities. As of now, we can understand if a child between the ages of 2 and 9 have some type of disability, but we're not quite sure what it is because of the way the data are collected. Likewise, we don't have really any information on children under 2 in terms of their risk for disability. Exposure to environmental toxins is a concern that's been raised, but there's been very little measurement on that as well. So exposure to pesticides or heavy metals like lead and arsenic could be very common in different parts of the world, but there haven't been really attempts to measure those. As has been mentioned earlier by Taryn, there should be some kind of monitoring of children's exposure to violence, both within the home and in the community, and even at a larger kind of national level. And finally, I think there should be efforts to link measures and indicators across sectors. So currently, it seems like we have health and nutrition sectors collecting their data, and we have the education sectors collecting their data, but there's not good ways of linking those. So teachers might not know that they're getting children who are at risk for not learning well. So it would be great if there could be some more communication on the well-being of children across the sectors that directly involve them. So I wanted to highlight some efforts, recent efforts that have been made or are being undertaken currently to improve the measurement of early indicators. This includes UNESCO's Holistic Early Child Development Index, or HECD, which is prioritizing 6 different core areas to develop indicators that will, in a more holistic way, measure early child development. I also wanted to highlight USAID's Center on Children in Adversity, which is not necessarily creating new indicators, but is working to try and help support their programs in identifying not only programs to implement, but ways of measuring them to support child development in a more holistic way. And the last 4 bullets here refer to recent efforts of early child development measures that are being developed and tested in various parts of the world that could be very promising for providing information on how to measure the youngest children. So these include the Guide for Monitoring Child Development, which is being tested in 4 different countries, the Malawi Developmental Assessment Tool, which spans from 0 to 7 years of age. So it's a measure that's unique in that it does measure across the entire age spectrum. The Developmental Milestones Checklist, which is authored by Amina Abu Bakar, and has been used in Kenya and I believe other parts of West Africa, and focuses on children under 2. And a very recent development is an effort put forth by the Global Child Development Group exploring creation of a 0 to 3 child development tool. So in conclusion, there's great energy being devoted towards ECD and developing indicators that we can use easily and reliably and across different contexts. These efforts need to be coordinated and shared and inform one another so that we're all working together instead of at cross purposes. Ideally, I think, would be a creation of a single source, perhaps an online source, an online warehouse of a kind where all of these different indices and indicators are stored and accessible to everyone. Instead of having to go look at multiple resource sites, you can have it all in one place. And finally, I think we should have agreement and support on a core set of indicators that can be used consistently across all the different organizations. Thank you.
Like me, can feel the challenges just emerging with all this work, both the fact that there's so much going on, really also at the national level. So you've got these global movements happening, but you also have a lot of work going on in countries and how we harmonize that, how we deal with the cultural issues, and how we put all of this data together in a cohesive way is really one of the challenges. We're lucky that that UNICEF has had a jump start on this, and we're really thrilled, Claudia, that you can present some of that information.